We'll talk something about rice and how to take rice. At the same time, the blood sugar should not increase. Because the moment you are diagnosed as a diabetic, everybody says take less rice, avoid sugar. For a country like this, where we have different lifestyle, there are many people who are going for shifts and all. In a family, you cannot have a separate diet for a diabetic person and non-diabetic people. When a person asks me what is a diet control, actually, what I say is, you tell me your diet, what you are taking is not a matter. How you take matters. I will tell you how to take it. So it is a method. The way you take rice, the way you take food, how much you take, how frequently you take, and what food you take, all this will decide the sugar spike. Now we'll talk something about rice actually, because it is a main food for most of us, especially South Indians. And this is about the glycemic index. What is glycemic index? It's a number actually. It is not a permanent number or a constant number, and it's a relative number. When I say relative, we are comparing with something else and give this another number. We are comparing with glucose. We have given glucose the number 100. That means what? You give a particular amount of glucose, for example 100 grams, and you plot a graph, how fast it rises, how much is raised, and how much time it stays in a particular level, the raised level and all. And with this behavior and for this pattern, you give 100. You take another food, give the same quantity of 100 grams of carbohydrate which is present in that food, and make a plot. So I compare the behavior of glucose with the food, how it behaves when compared to glucose. Based on this, how fast the second food raises the sugar and how fast it comes down. When you compare these two, if the glucose raises 140 milligram after 1 hour, and if the food raises only about 70 milligram of 1 hour, then the second. And this food is given 50, half, because it behaves not exactly like glucose, but behaves 50% like glucose. So it is given 50. This is how GA is decided. If you add something else with the second food, the race may not be same. For example, if you take a fruit, if you take a whole fruit and if you take a juice, the rate of rise of sugar will not be the same. You are taking a whole fruit, which will be less because it takes more time to digest. If the juice, it is already digested almost, 50% is done, so it will rise faster. So by modifying, by changing the method of taking, by adding some substances, you can definitely modify the glycemic index of a food. This is the concept behind reducing the GI of rice which you are taking. What all we can do and how much we can achieve, we can see. The very first thing is the choice of rice. You have long rice, you have short rice, and you have white rice, brown rice, you have red rice, raw rice, you have parboiled rice. All these are rice only, but they have different GI. Long rice, we take basmati rice, for example. The length of the rice is long, one. The structure of the rice, if you press the rice even after cooking, you can feel it's a bit firm. It's not very easy to press completely. The outer side may be soft, but when you press like that, the inner side may be firm. This alters the digestibility and the rate of absorption by our body. If you take the normal white rice, what we take, the rice is broken first. Second thing, it is completely cooked. If you press it, it will become almost semi-solid or liquid state even. Because it is completely cooked and soft, they try to stick to one another. That means they form clumping. When this clumping is there, the stomach need not work hard to make it absorbable, but it takes some time for the stomach to make the basmati rice digest. So it delays absorption, it delays the emptying of the stomach. Naturally, the raise is prevented, the spike is prevented, the rate of rise is also reduced. The basmati rice, after all, they are made of starches. You have two types of starches, amylose and amylopectin and all. We will not go very detail into that. But the point is, the basmati rice has got what is called resistant starch. Resistant starch means they resist the enzymes from digesting them. The normal enzymes which are present in your body cannot digest this actually. So, without getting digested, they pass the whole small intestine, they go to the large intestine, and there they are not digested but they are fermented. In fact, this fermented rice helps the gut bacteria, the good bacteria which is there in the large intestine. So when you take a basmati rice like this, GI is reduced, the spike is prevented, the fermentation process helps the gut bacteria. So in many ways, this long rice helps us actually. And when you polish a rice, you remove the bran. You remove the bran and germ from it. After all, the bran is a fiber. You completely remove it by polishing. You are not removing just the fiber bran, but you are also removing the vitamins which are present in the bran. And if you take raw rice, this is also equal to taking almost glucose, 90%, 80 to 90%. When you parboil, the process of boiling makes the rice a bit hard. If you parboil and if you don't polish, then naturally this one. Comparatively, it is got a less GI. Of course, the price factor, of course, basmati rice and all a bit costly. But remember one thing, when you do like this, when you prevent the spike, definitely the quantity of drugs you are going to take will be a bit less only. And the complications will be less. So when you compare expenses wise, you can reduce the expense of the drugs or unpolished rice. There are a lot of methods to take rice without increasing your blood sugar level by modifying the glycemic index. So if you take a whole grain rice or brown rice, along with this, if you add some fiber, some vegetable, that also will delay the emptying and delay the absorption or digestion of this. And you can still reduce the glycemic index. The next process by which you can reduce GI is add some healthy fat during cooking. What is a healthy fat? A fat which does not increase the risk of heart, a fat does not increase with the cholesterol level, and a fat which supports the function of your body. Not only that, fat is very much essential for absorption of certain vitamins, fat soluble vitamins A, D, E, and K. These vitamins, they need fat to get absorbed. So you choose a healthy fat and add. What can be added? First thing, you can add ghee, butter, olive oil. You can add coconut oil, and easily available is coconut oil. You can add coconut oil, 1 teaspoonful, 5 ml or 4 ml for every half cup of rice. Mix it in the water and then cook. How they help in reducing the GI? Number one is fat is not easily digestible. So it delays the emptying of the stomach. The rice which is there in the stomach, it takes some time to reach the next part. Only the next part is absorbed as glucose into the blood. So we are delaying that. When I delay, automatically the rice is not fast. So slow rice and there's no peak actually. Second thing, the oil, they form a coating around the rice. This prevents the enzymes to act upon the rice. It becomes a barrier for the enzyme to act. So it takes some time. This also will reduce this. And this fat, when it combines with the starch, it increases the quantity of resistant starch And as I told you, resistant starch are not very much absorbed. They go to the large intestine. That's another mechanism by which it reduces the GI. And even though it's a fat, because it helps in this way, because it reduces GI, the calorie absorption is also reduced. In that way, it may even help in weight management. The next thing is add an acid. Make the environment acidic environment by adding either vinegar or some lemon juice. Acidity actually lowers the glycemic index of a meal or a rice. The other way it can help is it prevents the stickiness of the rice. In that way, it prevents clumping of the rice. When the clumping is prevented, then the absorption is a bit delayed. Not only that, the acid prevents the growth of organism in a meal. It prevents the food becoming rancid. You can use either rice vinegar or the white vinegar, and you just add half to 1 teaspoon per a cup of rice. Next thing what you can do is you pair this rice with the protein and fiber. Protein takes longer time to get digested and fiber does not get digested. When you combine these, naturally the GI will be reduced. In other words, when you combine a high GI rice with a low GI protein or fiber or vegetables like that, the GI of rice is reduced. This is a concept. And the stomach does not separate protein, fiber, and rice and then digest it. It is not like that. The stomach makes everything into a clump and sends everything to the next part. There, that particular portion, that intestine has to separately absorb this glucose and convert it into glucose. It takes time. So when you combine protein, fat, carbohydrate, vegetables, fiber, it becomes a mixed diet. Otherwise, you can even call it as a balanced diet. Naturally, you get everything, but without getting the blood sugar spike. Next is the cooking method. How much of time you cook depends upon many factors. Many of us cook only with a pressure cooker, and many of us do not count how much whistle it is has gone. We just forget, and most of the time, the cooking time is increased. When the cooking time is increased, it becomes almost very much sticky. The gelatinization process is accelerated by your overcooking or extra cooking or timing like that. So overcooked rice will definitely have high GI. Next, how much of water you add. Even this people differ because it all depends upon how much of time you give for the rice to get cooked. If you add less water and less time, you are not overcooking. Sometimes you are not very definite because you use different types of rice, and every different types of rice needs more or less water. You are not very definite. Every time you get new rice, so the amount of water you are not very definite. So when we usually add more water and we give more time to cook, definitely you are increasing the GI. The next point is avoid overcooking. As I told, what is overcooking? Overcooking breaks down the molecules into simpler forms, makes the body to easily absorb it. In fact, you are doing a thing which will increase the GI. So overcooking, you can use the word al dente. This al dente is less cooking, not overcooking. It is actually used with pasta, but you can use this here also. Al dente cooking. You should have a soft surface. On the outer side, it should be soft. But when you compress, you should feel the firmness when you go in. And see that the rice keeps its structure. And see that they do not clump. When you overcook, all this happens. So better don't overcook. And the water, the timing, and if it's a pressure cooker, the whistles, everything counts, which may alter, which may modify this GI. Then finally, when you have followed all these things, the choice of rice, adding healthy fat, adding acid, and undercooking, and adding fiber, and making this resistance starch, all these processes you have done. Now you have cooked, the rice is there. What should you do now? After the process is over, And don't take the rice immediately. Keep it in a fridge. Cool it minimum 8 to 10 hours and then reheat it and take it. So if you want to cook today, cook it yesterday night itself and keep the rice in the fridge for 12 hours and the next day take it reheat. Reheating will not increase the GI because the cooling effect, it converts the digestible starch into a resistant starch. Again, the resistant starch will not be absorbed properly. It goes to the large intestine. So this is how cook, cool and reheat process helps. Of course, we have been doing it long back, the old rice, the cold rice, something like that, without knowing the reason, without knowing why we did it. But now you do it in a proper way, you will reduce the GI of rice. And finally, there's a point, the portion size, how much you take. Feel that and see that you are eating. Don't look at the phone or don't look at the TV and start eating. I have seen many people 250 grams of peanuts in a small bag without opening it, put a small hole and go on eating for 1 or 2 hours, 2 hours till you complete a movie. And finally, the movie ends and you have emptied the pocket also. That means the best thing is portion, how much you take. Take some peanut and keep it in a small plate, finish it, that's all. You know what you have taken and you know what is remaining. But many people do not do that. They take and take and take. Portion size and serving size. In a food label, you will have the serving size. The serving size shows how much of that particular food contains what. It will say how much carbohydrate, how much fat, how much protein, how much vitamins. All this will be there in the label per 100 grams. That 100 grams is a serving size, but portion size is how much serving size you take. You may take 200 grams. That means you are taking 2 serving size. If you reduce the portion size, definitely the quantity is reduced. What I want to tell is even with a low GI food, will become a high GI food when the portion size is more. I think I have given some points in which, without much worrying about not taking rice, you can take rice provided you follow these methods, and you can reduce your tension, you can reduce your sugar, you can reduce your expense, and you can reduce everything for that matter. Of course, you can increase your satisfaction and happiness. Shall we meet again in some other topic? Thank you. I am Dr. BALA'S.